Hello everybody and welcome to the Thursday edition of Video Clips, and I have again with me Dr. Peter Breggin. And you might remember last week we were talking about the effects of attention deficit disorder drugs used to treat the disorder and how terrible they are. And so I think what we have to do, I think we can make a strong case to not put children on the drugs, but what are you going to do instead of that, right? So let's talk about that a little bit. And I want to start by asking you about something and see what you think about this. So I read a book written by Marilyn Wedge, who's a psychologist, and the book is called A Disease Called Childhood. And she says exactly what you say, that we're medicating childhood. We're saying it's inconvenient for you to be a child, so let's put you on a drug. But she had another thing that she talked about that I think is interesting, and it goes to the point, why do so many boys have attention deficit? Many more than girls, right? And her theory is this, that preschool has gone from being a playtime. You know, I remember when I was in kindergarten, we played, we colored, the teacher read to us, we learned a few things, but it's pretty unstructured. And there was no preschool when I was a kid, because we were just outside playing and running around and, you know, blowing off steam that way. Now we put children in preschool, and preschool has gravitated to the place where you have to do structured learning. You're supposed to learn something. Then by the time you start kindergarten, you're supposed to know something. And then by the time, I mean, even reading, kids are learning to read in kindergarten. Well, what happens is boys mature differently, slower than girls. And so the boys really take the brunt of the effect of this structured learning in preschool. And by the time they get to first grade, they're very far behind. And this is part of what may motivate the bad classroom behavior. And in Finland, they have gone from structured preschool to preschool's just playtime. And they've made a huge reduction. There has been a huge reduction in the incidence of ADHD. So I'm wondering if you have some thoughts about that and what you think.
Well, instead of talking about the incidence of ADHD, we got to get rid of that language to begin with, because it's not a disorder.
Right.
It is a range of different behaviors. Let's suppose a kid really can't concentrate. Mm-hmm. What could be the cause? Right? He's afraid of the teacher, doesn't have rapport with the teacher, hasn't kept up and been taught well enough so that he's ready for the level of the class, is slow in reading, which is natural, by the way. Human beings have only been reading for a few thousand years. We didn't evolve to read, we evolved to talk. And then we gradually started making pictures. But reading is very new. Some people are good at it, some people aren't. It's just the way it is, folks. And now we have so many different alternative technologies to help people with the reading issues. It's just not a disease. It's an attempt to get children to conform in classrooms which you couldn't pay them to be in when they're adults. Mm-hmm. So if you gave the average adult $100,000 a year, and all he'd have to do is live like he did in elementary school with one teacher raising your hand to go to the bathroom, can't talk to your neighbor, you're all in chairs, they wouldn't take it.
None of us want to sign up for that.
Would sign up. And so we're not even training our kids for things that are going to help them later in life. And you've said this, we're training them to be docile. Mm-hmm. And the drugs enforce docility and passivity by ruining the imaginative, creative, spontaneous ability of the brain. It's no more complicated than that.
Now,
there's not a single study that shows there's any benefit from the drugs beyond 4 weeks of docility, which everybody thinks is wonderful, and then they up the drug and change the drug. But the brain fights back and makes the kids more active, and then they make them disturbed. And eventually, it's a gateway drug. We've talked in an earlier session, marijuana is a gateway drug to other kinds of psychoactive substances. Ritalin is the gateway drug to becoming a permanent psychiatric patient on permanent psychiatric drugs. We now have studies going back to the 70s, follow-ups by the people who put the young children, boys, on small doses of Ritalin for something the teachers thought was hyperactivity in school, but the parents didn't notice. That's what we're talking about. Wouldn't even qualify now. Mm-hmm. if you don't have 2 places in which the kid is hyperactive. And it had nothing to do with inattention, just a little hyperactive. The adults on follow-up, more time in jail, more time in mental hospitals, on multiple drugs, more obesity, less education, quality of life by any measurement reduced. And what is the cause of that? They're not even on the stimulant drugs anymore. Now they're on the antipsychotic drugs and other drugs that have literally ruined their lives. Now, they don't want to admit this is what they're seeing. This is the results of ADHD. These kids had nothing wrong with them. They weren't normal at home.
Right.
They were normal at home. They were just fidgety in school. Literally, all they were, fidgety in school. So we're looking at what happens when you poison a child's brain, and we're looking at what happens when you tell a child they're not responsible for themselves, and when you tell a child that a drug is the answer to your problem. You actually learn from it, as you said very well in our earlier introduction to this issue of ADHD.
Now, so a parent's watching this and saying, okay, I think I understand this and I don't want my child to take a drug, right? So now we have to do something about it. So you see people bring children to your office who have been problems in some way, shape, or form, which is sort of what being child is all about. So talk about the process of helping a family with a child with ADHD if the plan isn't to medicate or to get off medication.
Yep. Okay. Well, I'm going to invent them. We have Joey and Mom and Dad. That's usually the combination. Sometimes Grandma, if they listen to me, and bring in the extended family. So they all walk in. Actually, I go out to the waiting room, and the first person I address is Joey. I say, "Hi, Joey. How are you? I'm Peter Breggin. Glad to meet you." And he's a bit surprised I use my first name. He's a bit surprised I'm smiling. He's a bit surprised I'm wearing a funny Hawaiian shirt, which is what I wear all summer. I have an array of Hawaiian shirts that I use when I'm seeing my clients. They're not garish too much. And I even say, "Joe, you want to come in by yourself? Or you want to come in with your parents?" Mom or Dad might say, "Well, why don't we all go in?" I say, "Well, that's fine too, Joey." Is that all right? Sure, we all go when you sit down. I say, "Joey, do folks tell you why you're here?" And Joey says, "Yeah." What'd they tell you? They said that you're the doctor who doesn't believe in giving drugs for ADHD. I said, "Joey, I don't even believe in ADHD." Joey looks at me and says, "Boy, the other doctors must hate you." I say, "Joey," and the mother goes, in the silence. I say, "Joey, that's so true." I mean, it takes a lot of your age, Joey, to catch that right away. But that's how it is. Yeah, of course it's that way, because I'm interfering with how they make a living, with what they believe in their hearts, and they don't know how to help kids. And I noticed, Joey, you're not fidgeting at all. And maybe he fidgets a little bit. Maybe Dad or Mom will say, "Well, when he's really interested in something, he doesn't fidget so much." I said, "Well, I'm glad. I'm interested in you, Joey. You're interested in me, and we're going to figure out what's going on here." Now, is there a report on Joey? Yes, 20-page comes out. And I look at the first page. You see, Joey doesn't say anything about your great smile. Doesn't say anything about how smart, brave, and incisive you are. It's got a bunch of Joey, this is a bunch of baloney. I'm not interested in this. It doesn't even, I already know how smart you are, how you can control yourself completely when you're engaged. Let's get rid of this. So what's going on here? So let me talk about what's going on. Now, I'm going to assume that those of you watching, some of you at least fit the traditional pattern. You got a mother and dad, because that makes it so much easier than being a single mother with 3 10-year-old boys or something, if that's possible. If I wanted to really put somebody through the real tough situation, I'd make you a single mother with a preteen, teenage boy and no father. So let's assume that's not the situation. We could just deal with this time. Dad's at least enough in the picture to come. Maybe he's divorced, whatever. So we got the family here. And Joey, Mom says something, and Joey smirks at her. I look around. What's going on here? Joey, did you just smirk at your mother? Dad, you saw that? Yeah. Well, why didn't you say, "Joey, don't smirk at your mother"? He said, "Well, I'm not sure how to behave in the office here." I don't buy that, Dad. I'm seeing you. You're watching, and I'm going to really help you not do that anymore. But you're just watching, and Joey was giving a little minor torment to Mom. So I'm gonna help you guys really get things together. Joey, I'm going to have your parents learn to give you genuine discipline. Somebody told them you had a disease and you're beyond normal. You're super normal. I mean, to say that, what you said to me at the start of the session, and to be listening, glued to me now. So we're going to teach Mom and Dad to help you be respectful. That's going to be the first thing we do. We may not even talk about anything today except respect, with a hint that next week we'll talk about love, if we don't get to that today. But respect, you are going to be taught to respect your parents. And Joey, this really did happen. All this has happened. Joey says to his parents, I told you I was just a brat. And I say, oh, God bless you, Joey. You just come over here and sit down next to me on the tacit, would you? He comes over and he puts his head on my leg for a minute, and then he gets embarrassed. He sits up. And we're really moving now. So I say to the parents, look, Joey actually fits what's called the Adhd criteria. He doesn't like school, he doesn't concentrate well in school, and he fidgets when he's not with somebody who he finds interesting, and so on. And there's nothing outside of that, right? Joey, he's not beating anybody up. Joey, you're not seeing things that aren't there. Right? We get all that straight. I said, okay. I give you my one guarantee I give in my practice. Maybe there's one or two others, but this is really the guarantee. If you, Mom and Dad, you work with me for a few weeks, by the second or third week, everything's going to be so much better. You can't believe it, because I'm going to help you do a combination of simple discipline, believing in you. But Joey doesn't listen to us. I know. You don't act like he's supposed to. I'm going to teach you to act like he's supposed to listen to you, and then he'll get it, and he'll listen to you. And then I'm going to teach you that you can be loving even while you're disciplining. And that's what basically I'm going to teach you. And Joey's going to do better. And then I may look at Joey and say, Joey, I'm going to tell you the most important thing probably anybody's going to tell you in your childhood. What you're doing now, disrespecting teachers and disrespecting your parents, and acting like school doesn't matter at all, is really, doing those things is really, really bad for you. Regardless of your parents complaining, even though it makes them upset, and you don't get ready in the morning and it's all a mess in the house because of what you're doing, even though that gives you a great sense of like power, we want power, don't we? It gives you power over your parents. Terrible for you. So if your parents don't change, you gotta change. It's always gonna be ultimately in your hands. I want you to go into the classroom tomorrow, and I want you to smile at the teacher. Give the smile you've been giving me on and off the whole time. Give her that smile. And by the way, it's probably a her, because men don't have the same degree of ADHD, so-called, in their classrooms, because we were built to discipline boys. Our voices are darker, you know? And boys are taught not to respect women, but to at least have a certain fearfulness or something of adults and males, and hopefully to respect. So it's just going to get better for you now. And when you walk in the classroom and you smile at the teacher, you know what she's going to think? Nobody has a guess. She's going to think that all the work she's been doing to try to help you is now working, and she's going to be proud of herself. And we won't tell her. She's going to be proud of herself, because you've started to act like you respect her and you're glad to be there. And that's going to be a part of your life from now on, wherever you go. I want you to look respectful, glad to be there, until you decide otherwise and you're an adult and you can leave or not leave. But you got to do it, even though your parents don't necessarily get it all straight, but I think they will. Is that clear? Does anybody have any questions about anything I'm saying today?
I love that. You know what I love about that? I love so many things about that, but the idea that even a small child can be taught I'm responsible for my behavior, and there are consequences of behavior, good and bad. When I behave in a certain way, things are pretty good, and when I don't behave in a certain way, things are pretty bad. And if you teach that lesson early in life, and a drug will never teach that lesson.
Oh, God, no.
Yeah, yeah.
I'll give you one more quick example of the issues, which is the aggressive boy, and which is actually not ADHD. I mean, people forget that ADHD is nothing more than you're behaving like a boy, and we don't want it.
A disease called childhood.
A disease called childhood. All right, so but now we get into oppositional defiant disorder or something else.
There's a name for every behavior, right?
Yeah, right. So the boy's aggressive, so he comes in, and we sit down again. And I'm just going to assume we have this. Now, by the way, if there's no father present, I work with the mother on who you're going to get into that situation to help. And if there's no one available, then I'll be your dad, Joey. You'll be coming here every week, not because you have a mental illness, but because I love you, and I'm going to be your coach, and your mom can afford it. Welcome me to the family. I don't make believe I tell them it's not a medical treatment. I tell them there's nothing wrong with them. And there's nothing wrong with hardly anybody in a sense, because we're all reacting to something that was done to us and we haven't figured it out yet and learned how to change that. All right, so the boy comes in. This is another true story. And I've been told on the phone that he physically, this skinny 10-year-old, attacked his last psychiatrist. And on that day, the psychiatrist had said it's time for an antipsychotic drug, and the boy attacked him. So we come in and we sit down, and we're all together again. And I'm addressing Joey. I mean, after all, Joey's capable of relating to me, and always, kids are always respectful, I mean, unless they're psychotic, unless they're really, then I have to work a little harder. Same thing, I just work harder. So he comes in, and I say to him, first words out of my mouth, Joey, I hear you attacked your last psychiatrist. And the parents go, and he says, yeah. I said, Joey, that was so brave of you. It was so brave. You like me, Joey, because I'm standing up to psychiatrists every day of my life and doing things like what he was about to do to you. So brave of you. But Joey, I figure out ways to decide whether I have a chance of winning and whether I can avoid getting hurt. And when you attack a grown person in authority like that, you are putting yourself at such risk, honey. You just can't do that anymore. I mean, psychiatrists out there's probably 30,000, 40,000 who don't like what I'm doing. If I ever attacked any of them physically, it would be the end of my successful career. You can't do that. Does that make sense to you? I'm going to teach Joey how to stand up for yourself so that you don't get into trouble. Because I think you're probably a lot like me. If I had been your age and I'd been on drugs, which loosened my self-control, I might have attacked somebody because I was a little boy that didn't take nonsense from anybody. I actually had that idea that I don't take nonsense from anybody. And I would have gotten drugged now, probably, Joey. So it didn't happen to me, so I never did anything to anybody like a teacher. So let's get that straight. You are brave, you are strong. I think, Joey, you're determined more than anything else in life. You're not going to take any more crap. Whoa, where did he get that one from? And I got that, but you know, there's a lot of crap, and if you've made up your mind you're not going to take any crap, you're not going to have a life. I'm just going to help you understand what's going on. Are you guys clear? You guys okay about what I'm saying to Joey? Well, they're very little puzzled. It sounds kind of reasonable, totally unexpected. And I said, has Joey attacked you? Well, he hit me, Dad said, yesterday. And what was going on? I was trying to restrain him because he was walking out of the room on me. Okay, here's the deal, folks. And I hope you're going to really get all this, because this is so true. Nobody in the family is going to use their hands anymore except to protect each other and to love. So hands are for loving, and that's it. Unless we have to say, save a toddler from running in the street, or we can protect ourselves but not aggressively from each other. So no more hand stuff. Joey says, "You really got that, Dad?" I said, "There's more to this, huh, Joey?" He slapped me 2 weeks ago. "Dad, can we make a pact?" And they always do. "I know you hated hitting your son. Just let me coach you, because that's what I'm doing. Let me coach you. Look, you're going to give up hitting. Joey, you're going to give up hitting." Mom says, "He hit his little sister, Janie. He hit his little sister, Janie. That was really terrible, and she made her cry." I said, "Joey, you did what?" And now he's really looking like this was wrong. He finally got it, maybe for the first time, that this actually is not a right thing. He said, "Let me give you a secret. Well, first of all, come here. Let me see you. Come on. Let me see you. Make a muscle." "And your sister's what? She's 4? And you hit her with that arm?" Joey, another big secret. I'm giving you big secrets today. We may come back to them. If you use that arm to defend her, to give her a sense she's got a strong, big brother, you're going to have somebody who loves you for the rest of your life. It's a guarantee. If you love her and watch over her, and if some girl in the class below teases her, you go and you say, "Let go. Listen, you can't tease my little sister, okay? I'll just walk away." If you watch out for her and stop teasing her, it's so easy to tease girls, Joey. Believe me, it is not a big deal to be 4 years older and to tease a little girl. If you let go of all that, you're going to have something that's a treasure. You're going to be loved and appreciated. You're going to be a big brother. So we'll talk some more about that. But anyhow, there's no more hitting in this family. Anybody who comes here, you can talk about the hitting. I can't do anything to you and punish you. I'm not going to report you. I don't think it's an abusive family. So we're safe here. And Joey, I'm not going to give you any more drugs. We're going to wean you off what you're on. And we're going to work on no hitting and respectful relating. Could that be a good start? It would be almost unheard of for people not to say yes.
Right. And you're teaching people to love each other, to protect each other, and that these problems are not problems. This is not a Ritalin deficiency problem.
It's a parenting deficit disorder.
Right. Well, and you know something, that, and I want to say this too, because we talked in a previous video about not making parents feel bad. The fact that you need help bringing up children in this day and age is not a terrible thing, and you shouldn't be afraid to ask for help, right? And there are people who can help.
There are people, you know, I mean, you're much better off, first of all, avoid psychiatrists. There's just no way around it.
And you're a psychiatrist saying avoid psychiatrists.
Yeah, I mean, do you really want to put a neurotoxin into your child's bloodstream? A drug that poisons neurons, shrinks brain tissue, we have studies on that, leads to multiple drug use, increases the likelihood of cocaine abuse in young adulthood. Do you really want to do that? The answer is no, of course. So, you know, get the medical idea out of this. Bad behaviors come out of family life or something that's happening outside the family that's making it hard for the child to grow up and to learn self-control, to believe in himself, and to get what he wants without making trouble.
And in a constructive way.
In a constructive way. And you can't tell your kids too much how great they are. And you can't tell them too much how much you love them. You just can't.
Or anybody for that matter.
That's what I was thinking in the back of my mind.
All right.
I love you, Pam.
I love you too. And you know what? We have spent a lot of time together making some magical things happen. If you love what you've been watching on these clips for the last 3 times that you've watched, you should take The Heart of Being Helpful, which is going to be our new course. We're introducing a conference on people helping people, because a lot of this can be done outside of a professional's office. People just helping people.
Wow. Don't you need a doctor for this? Don't I have to have a
license?
tie on?
You have to have a license.
I've turned a corner, partly because Pam is helping me do what I've always wanted to do. I've turned a corner, and I'm no longer even worrying about whether people are licensed or unlicensed, or whether this is a way to talk to psychiatrists or to talk to children. I'm going to be using these videos with Pam to teach people what they need to know about helping other people. And if you're a parent with a psychotic son, I'm not going to say drag him to the psychiatrist, because the psychiatrist knows how to talk to your son when he doesn't. I'm going to be teaching you how to relate to and help your family, whether they're distressed or disturbed. And then if you want to get professional help, that's up to you. But human beings have been teaching each other how to take care of each other since time began, because we're born without the knowledge. Therefore, we all get taught this during evolution, or we wouldn't be here anymore. Because human beings have had messed up difficulties with life because of our complexity forever, and because of enemies and starvation. You know, it's just hard. Jealousy and envy. I mean, that's who we are.
But we can do a lot to help ourselves and each other.
So much.
And that's the heart of being helpful.
And I'm going to be giving out information that actually the other professionals don't even have. I mean, how many of them are relating the way I'm relating to kids and parents? Genuinely, straightforwardly, good solid information, moral expectations, you know, the real stuff.
The real stuff. All right. Well, as usual, thank you so much for watching, and do pass this on to anybody who you think might enjoy watching it as well. Hit the subscribe button. We're building our subscriber base, and every so often we give out gift certificates when we do drawings, and I'll be back to you with more news next Tuesday.